Hey, so in this video, we're going to be learning about joints and muscles. We're going to be seeing how joints and muscles work together to create movement around the body. Also, if we have some time, we're going to be taking a close look at a sports injury so we can see what we can learn from that. All right, let's get started. All right, so let's get started with joints. Joints are classified as either structurally or functionally. The structure classification of joints is based on how the articulating surfaces of the bones are connected. The functional classifications are based on the amount of mobility between the adjacent bones. In a fibrous joint, the bones are connected by a fibrous or dense connective tissue. One example we can think of is a tooth and how it's anchored in the socket and it's secured by a short layer of fibrous connective tissue. Let's look at one example of a joint. One of my most popular examples is the knee. So on your screen you can see how the tibia interacts with the femur up top, and they are joined together, or their meeting point has a cartilage that aids in smooth movement of this joint. The cartilage meaning the meniscus on the tibia and the articular cartilage on the femur. And so once the ligaments are there to restrain the knee and restrict the movement to front and back, you have a joint that can move smoothly in its direction and aid in movement of the leg and the body forward. And in this photo, you can also see how the muscles interact with the joint. You see the quadriceps on the top. Not labeled is the quadriceps tendon that will secure the quadricep to the bone and aid in that movement when someone's ready to stand up or to walk or to run. All right, and that leads us to discuss muscles. So there are three types of muscle tissue in the body. We have skeletal muscle, we have cardiac muscle for the heart, and we have smooth muscle for involuntary functions elsewhere other than the heart. Skeletal muscle is attached to the bones of the skeleton and is the most extensive of the three muscle types. It's responsible for voluntary movements or movements of choice around the body. Cardiac muscle is only found in the heart. It is involuntary, it's controlled by the nervous system, and its timing is regulated by the sinoatrial node, which we'll talk about later. Smooth muscle is found in the tubular organs of the body. So if you think about the GI tract, the digestive tract, and how muscle is used to push food along through the digestional tract, that's where you'll find smooth muscle. The cells of each type of muscle has unique microscopic properties. The skeletal muscle is cylindrical, striated, and multinucleated. A cardiac muscle cell is striated with a single nucleus. A smooth muscle cell is a football-shaped and non-striated and contains only one nucleus. So in terms of muscle systems, muscles of the axial region are found in the head and trunk of the body, whereas you can find appendicular muscles in the rest of the body. Axial muscles contribute to facial expression, movement of the head and neck, abdomen, breathing, and support the pelvic floor. Some axial muscle crosses over into the appendicular skeleton. Appendicular muscles are found in the upper and lower limbs and around the joints that connect the limbs to the axial skeleton. The appendicular muscles are responsible for movements of the arm, the forearm, hands, fingers, and others. Some appendicular muscles stabilize and move the shoulder and hip. All right, so I just wanted to show a few pictures So in this photo, you can see that it is a radio image of the knee. And on the left side of the screen, you can see the patella very clearly, the large mass on the left side of the screen. In the center, you can see, in the center on the top, you can see the femur. And what I really want you to focus on is where the femur and you can see the fiber or the cartilage that's in between them, and the density change between the femur and the cartilage between the femur and the tibia. You can also see the connective tissue in various places, and so that gives us a good idea of how these joints are made up and how they're connected, and you can imagine how they would bend and function as well. All right, so in keeping with the same, I just wanted to go back to our earlier picture, and I wanted you to focus on the two ligaments in the middle, the anterior cruciate ligament and the posterior cruciate ligament. These two are responsible for restraining the knee in a particular direction. And so now let's look at an abnormal picture. So you can see a picture here where there's an ACL tear, as they're calling it, or an anterior cruciate ligament tear. And so that usually comes about in a car accident or in a football or sports injury. And so we can see that when this takes place, when this tear happens, this injury happens, it really affects the joint, right? So the knee can't function the way it normally does because of this ligament being severed. And so in cases like this, you'll see someone with a dangling leg at the bottom, and they're unable to bend their knee properly. And so the only remedy for this particular type of tear is a surgery.